Hi, this is Dr. Brian Castline with Brighton Foot and Ankle. And in this video, we're going to go over ankle sprains, predominantly to the outside portion of the ankle, where we call these lateral ankle sprains. They're important, they happen. 30% of all sports injuries involve rolling of the outside ankle and pain to the area. It's important to get your ankle checked out if you can't walk on it, if you notice a ton of swelling and bruising to the area, or if you have a nagging ankle sprain that just won't get better after 6 weeks. Those are all indications to go get an x-ray, to talk to a sports specialist and see if you're having any long-term effects to the area. We're gonna spend on 3 things. The first one and most important one being the ATFL, or the Anterior Talofibular Ligament in through here. This is kind of like the ACL of the ankle. This is really important and is a dynamic stabilizer of the foot and ankle, which prevents the foot from sliding forward onto that ankle. This unfortunately is our weakest ligament onto the outside portion of the ankle, and it's also the one most commonly injured. 2 other ligaments that we don't really concern ourselves with as much is called the CFL, or the calcaneofibular ligament, which is out here on the outside portion, as well as the PTFL, the posterior talofibular ligament, which comes off the back. Generally speaking, these last 2 ankle ligaments aren't really damaged in our injuries, so we really focus on the ATFL. Now, when we have a bad injury or bad sprain, a partial tearing of the ATFL can happen as much as 52% of the time, where complete ruptures or complete tears of the ATFL happen only around 15% of the time. These can be difficult to see because rarely do we see an avulsion injury or a fracture of the fibula, which is showing us that there's injury to the area. That only happens 13% of the time. So a lot of times the ATFL can get sprained or torn and it's not going to show up on x-ray. This is where we need a good clinical exam to see if the ankle is loose. We need to see if you have pain to the outside portion or the lateral gutter of the ankle out and through here. And we also listen to your history. How long ago was the injury and how much better are you getting? Now, in these really chronic ankle sprains, something that just doesn't get better, or your ankle kind of flops around and you don't trust it, you don't have the stability of it, well, that's when an MRI comes in. An MRI is really good at showing us the intricate details of that ligament. It shows us if there's any swelling or damage to the bone as well. But this is kind of what we call our gold standard test to see and evaluate the ATFL and the outside portion of the ankle. When it is torn, and especially if you're younger or very active or find yourself unsteady, well, then you might need to have surgery to repair the ATFL. We have some other videos on how we do that. The surgical procedure is called the brostrum. But otherwise, if the ATFL is intact and the ankle ligaments look good, sometimes a brace, some icing, mobilization, those can be ways to help allow the ankle to heal and to get you back into your sports. Either way, ankle sprains and tearing of the ATFL are real things. These do happen. So if your pain is persistent, if you are continuing to have instability to the area, give us a call or give someone in your area a call and get your ankle checked out.